to help break down what we should be taking away from that information, I reached out to a Las Vegas infectious disease specialist today. Her name's Dr. Christina Madison. She's an associate professor of pharmacy practice at Roseman University of Health Sciences right here in the Valley.
So looking at the numbers, because really it's all about the data, is that yes, we have had an increase in our number of cases, but we haven't had an increase in the number of hospitalizations and death. So I think that's what's a little bit more comforting. However, I will say that we are using this new color-coded system when we're looking at the United States as a whole and whether or not you're at risk. And so the color coding is green, yellow, orange, and then red. So as you can imagine, green means that we're containing the outbreak, and red means that we're seeing an exponential rise. So right now, Nevada is considered orange, which means we're at risk. But again, we have not overwhelmed our healthcare system, and we still have ICU and ventilator capacity.
Dr. Madison also touched on the lag time between what we're seeing play out, so things like casinos reopening or the large protests happening across the state and the country, and how that impacts the data being reported. Today's numbers don't represent what happened today, and here's why.
The incubation period, which is the time frame before you become sick, is anywhere from 2 to 14 days. Average is 5 days. And we know that people are what we call infectious, meaning that they can give it to someone else, about 2 days before they start showing signs and symptoms. So overall, if you take all those numbers together, it's going to take anywhere from 1 to 2 weeks before you start seeing those people seeking medical attention.
Now, one of the things Dr. Madison wanted to emphasize was that as we continue to test more, the number of cases will likely go up. But again, it's those hospitalization rates. That's what the experts are really trying to keep a close eye on right now to make sure that we can, again, continue to flatten the curve and the healthcare system doesn't get overwhelmed.